Hi everyone, this is Dr. Heather Austin Robillard again, and this lecture is going to be Grant Writing 101. This lecture will help you understand how to apply for a grant funding when you're working on a prevention program for substance abuse. It will be helpful to know when you're working on your grant writing group project. Okay, so first off, where to begin when it comes to grant writing. So what are grants? First, grants are different companies, the government, organizations that provide monies for other organizations, individuals, groups, in order to do something in particular. So there's research grants where people will give money for you to do research in a certain population or with a certain type of topic. But specific grants when it comes to prevention programs is that they will give you money in order to run your prevention program in a specific community. And so in order to get that money, you need to write a grant proposal, basically telling them why you would need this money, how you would use it, and why it would be beneficial to the community. So it's important to understand what goes into a grant writing package, and they can be different depending on the company, the person giving the money away. You want to make sure that you read the grant application because each grant can have different components that are needed. But overall, most grants include 9 specific steps that you'll want to go through. I will teach you about how to order your grant application based on these 9 steps for any future prevention programs that you might apply for money for. These 9 parts of the grant application include the proposal summary, an introduction and organization, a problem statement, project objectives, project methods and design, project evaluation, future funding, the project's budget, and any appendices that might go with this grant application. So before I go over this slide, the example that I wanted to give you, so to kind of walk you through what to say in a grant application, is going to be this prevention program called the Safe Start Healthy Students Grant Review from the collaborators at the Lubbock ISD and the Lubbock Juvenile Justice Center and what used to be known as the Lubbock MHMR, which is now Star Care. So they put together this grant in order to apply for money for their prevention program. And the first section that they did shows that the problems that this program hopes to address include the magnitude and severity within this specific community, which is Lubbock. So in Lubbock, 27% of children live in poverty. That is 15% above the state level. So again, it shows that severity and magnitude. 25% are without health insurance. 55% of children qualify for free or reduced lunch programs. And in 1999, rates for murder was at 14%. Rape was as high as 54%, and aggravated assault was at 65%. All the juveniles in the long-term residential program had a DSM diagnosis, and 39% of them had a learning disability. For the 12th graders in this school district, in the last year, 40% of those reported using cigarettes, 69% reported alcohol use, 45% reported binge drinking episodes, 81% had friends who were also using alcohol, 56% had friends who were using other drugs, and 32% who had friends who were actually selling drugs. It was also important to note what evidence there were for specific risk factors. And remember, risk factors increase the likelihood for an addiction to develop or for problematic behaviors to proceed. The evidence of the community risk factors that may contribute to youth violence, drug use, and delinquency include that alcohol is a community-wide problem. 45% of the youth in the Lubbock Juvenile Justice Center were actually alcohol-related crimes. The prevalence of STDs in 15 to 19-year-olds is 10% of the Lubbock population. This is higher than any other age group. There is also a 23% rate of juvenile drug arrests, and 54% of those arrests are with some kind of weapon. As we also did in our needs assessment, there is certain protective factors or community resources to lean on. The district has 3 DAEPs, which are disciplinarian alternative education programs. The Lubbock Star Care is a wraparound service, which is a community-based programs to include youth and their family in mental health services. We also have the nonprofit organization United Way and the Boys and Girls Scouts and YWCA. There's also the Parenting Cottage and the Children's Advocacy Center. These are several of the community-based programs that help improve the conditions in the Lubbock community. Okay, so as I said, the first part in the grant writing application should be the proposal summary. In this first part, you're beginning to write about your project for the grant source. The summary will outline your project briefly and concisely. It shouldn't be longer than 2 to 3 paragraphs. It is best to write this section after you have written proposals so you can summarize the important information in the proposal summary. This summary is usually a critical part in the grant because it is what the reviewer will read first and can sometimes make or break your grant being even read. The second part of your grant proposal should be the introduction to the organization. Most proposals ask you to describe your organization currently, including past successes and projected future accomplishments. This gives them a sense of what your organization is all about in order to introduce your project proposal. You want to make sure you give your organization's mission statement and philosophy, describe any grants your organization and prevention program has received. You will want to discuss any success stories of the difference your organization has made on the community. The grant source wants to see that your organization is helpful. They are more willing to fund organizations who have made positive differences in the community already. Focus your comments to address the goals of the funding agency. You will want to tailor your goals for the program or the organization to be similar to what your funding agency's philosophy is. So if you are applying for a harm reduction agency, you will want to highlight the important parts of your organization that meet a harm reduction model. It is important for your funder to be impressed with your organization's credibility, especially in the community it's proposing it for. So for the Safe Start Healthy program, you might write something like, this project's commitment was evidenced by the signing an agreement between the school, mental health, law enforcement, local universities, and community-based organizations. The extent to which the staff are qualified and trained represents diverse experience in engaging underserved, underrepresented participants. Then you might list any other ways that your organization has provided to the community. The problem statement is another key component in your grant application. It should be clear and concise of the problem that you want to solve with the grant funds. Your problem statement should be well supported with facts to help illustrate the problem. Again, that's why I listed the data at the beginning of this lecture. This can be done through literature and research or a needs assessment. The information to support your problem statement should be directly related to the problem you addressed in your proposal. The next section, which is the project objectives, should clearly state what your goals and objectives are for this project. Applicants should explain the expected results and benefits of each objective and how they expect their objectives to turn out. There should be a list of the specific criteria of the grant program and how the proposal meets each criterion. The project methods and design section outlines the tasks that you will accomplish with the available resources or the funding. It is helpful to structure the project method in a timeline format to outline each step in the method. List the tasks which will have to be completed in order to meet the goals of the project. Then break it into smaller tasks and laid out in a schedule over the grant period. This will help provide a chance to consider what personnel, materials, and other resources will be needed to carry out these tasks. As we've discussed As we've discussed previously, it is important to show the project's evaluation. Developing an evaluation criteria to show the progress towards certain project goals. It is important to define carefully and exactly how success will be determined. Applicants should ask themselves, what do they expect to be different once the project is completed when establishing the evaluation criteria? For example, the evaluation plan was that TTU will conduct the evaluation, including cost-benefit analysis, and to help partners use the evaluation as a tool to develop sustainable decisions, supporting for a long term. 12% of the budget will be for the evaluation purposes. In this section, applicants may be asked to list sources of continuing funding after they conclude the grant resources. They may also be required to list other sources and amounts of funding obtained for this project. Your funders will want to know exactly where their money is going. Expenses should be outlined in detail for the project. Divide the budget into categories like personal salaries and benefits, travel, equipment, supplies, contract costs. Many grants will require a line-by-line budget item list. You should be able to show how the funds will be spent and who will be spending them. Demonstrate consistency with the projected activities on spending them. Many grant applications will actually provide you with a budget form that you need to stick to in your proposal. The last section would be an appendix section. This will include any other information that is needed. Some examples of this might include key personnel that will have access to the funds, letter of support for the organizations, and any other additional information that the grant might need, like assessment tools and evaluation tools. Hopefully this information will help you when you're doing your grant writing project and also lend well to more information that's needed for your prevention projects.